November 25th, 2025. Our patient travels from Michigan. He has had procedures done here already. As a matter of fact, he's doing fantastic. He's had disc surgery and piriformis. Now he comes back to us with sacroiliac joint pain. So a new problem, very common problem, pain in the SI joints. SI joints are the tailbone where it connects over on the right and left side to your hip bone, and lots of people get arthritis. Why is the table so high? Can we lower it, please? So, Henry, let's show the audience how people get sacroiliac joint arthritis pain.
Sacroiliac joint injury is a common cause of chronic back pain. The inflamed sacroiliac capsule tear generates pain signals. The best treatment for sacroiliac joint pain is the Deuk plasma rhizotomy. Sacroiliac joint pain nerves are destroyed. The advantages with the Deuk plasma rhizotomy is that it's an outpatient procedure that takes 30 minutes to complete, very minimal bleeding and pain after the surgery with immediate recovery and return to work the next day, as well as a 99% success rate and permanent pain relief with a single treatment. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-BACK, 349-6922.
That's the one. We're talking about Invasion of the Body Snatchers once again, and one of my staff is interested in watching. It's the 1978 one is the really good one that I like, with I think it's Donald Sutherland, right?
Correct.
Yeah, and a bunch of famous people like Leonard Nimoy is in there, you know, Spock. Except Spock isn't such a good guy in this movie. All right. Shot. All right, I need a new one. Did we show the audience how the SI joints cause so much pain?
Yes, we did.
Okay. Well, we've just finished the right side. We're going to move on to the patient's left side. Everything went well on the right side. Want to take that one out? Shot. By the way, what makes the surgery hard, go ahead and numb here and fact that bone right there, Jordan, let's show the audience which bone I'm talking about. You guys see this bone right here? Show them.
Yes, we do.
No, go to the left. Right there, right where the arrow is. See how it protrudes from lateral to medial? It kind of blocks our path of where we want to go. And it's that bone that makes the whole surgery so difficult. Shot. All right. Now, that's why we have to choose the trajectories that we choose, you know, to go in and make our incision where we do it. And one thing I like to do is I like to go deep into the joint. Deep, deep, deep. All right? By doing that, I assure that we get the anterior nerves. Just about done. I get the nerves that are in the front of this joint. That's the hardest nerves to get to. And you can't get to them with RFA. All right, we are just about done. Any questions?
At this moment, no current questions.
Shot? Thank you, everybody. Great job today. I think that should do it. All right. You never know if you got all the nerves. We hope we do. I certainly don't want him coming back from Michigan again. Go ahead. Any questions?
At this moment, no current questions.
I want to show you guys the entire surgery is done with these tiny little 4mm incisions. Let's do one more here. And we just put some staples in, but we're going to get those out tomorrow. And then he'll go back home with steri-strips. But that's it. You can see he had surgery before, not by me, by another surgeon. Laminectomy, discectomy did not work. We ended up having to do laser disc repair, and now we're fixing his SI joint. So have a wonderful day, and we'll see you all hopefully next week. Enjoy your Thanksgivings. If you celebrate Thanksgiving, if not, have a great rest of your week. And good morning. I'm Dr. Deuk, CEO and founder at Deuk Spine Institute here. I have a patient who came to us with severe, debilitating pain coming from below his spinal fusion in his lower back. He had sacroiliac joint pain on both sides, and there was no getting rid of it. There's only one treatment that works, and it's the Deuk plasma rhizotomy offered here at Deuk Spine. It's now patented and it's FDA approved. His insurance approved the procedure. He had it done yesterday. How do you feel today?
Great. That 99% better than I felt 2 days ago. Not kidding you.
And are you on pain meds?
No, I'm not.
Do we put you on some new meds that took away your pain, or is this from the procedure we did?
This is from the procedure.
And we did it less than 24 hours ago. Here you are back here. It was outpatient. Your pain is gone. You're not on any medication. There was no bleeding, no hospitalization necessary, and 2 tiny little 4mm punctures on the skin. You happy?
Oh, absolutely. I'd give you a kiss if I liked you.
You like me.
I
You
know
already
I
gave me
do.
a hug.
I
But
know I
kisses
do.
are off limits. My wife is the only one. My kids. That said, I've known you for a long time.
Oh,
We did your fusion many years ago. Because of the fusion, you wore down those SI joints pretty quick. So that's why we had to do your procedure. Very common in patients with fusions in their backs, they get what's called adjacent segment disease. And what that means is when you fuse a part of your spine that's meant to be bending and twisting, then that puts strain on other joints above and below, and they wear out faster. We do not recommend fusions on anybody, or laminectomies or discectomies, because they lead to fusion. We did your fusion many years ago.
oh yes.
Your insurance did not want to do the laser. They only wanted to do the fusion, so we did it. And now we're dealing with some of the sequelae of that, right?
Yeah, workman's comp was tough.
And people say work comp patients don't get better. Is that true?
Oh no, depending on what doctor you have.
That's right. And what treatment you have.
Yeah, absolutely.
If you have the right treatment, work comp patients get better. Isn't that true?
That is absolutely true.
Is there anything you want to tell your fans out there?
I'd like to start out by telling you in 1982 is when I first had this situation happen during a 5-car accident. And I've been living with pain forever, seemed like. Today I don't have any pain. I mean, I just don't feel any pain. That's how far I've come, along with this man, of course. Without him, I I don't know what I'd have done or what I'd done. One nurse one time gave me go see Dr. Deuk. He's the best. Well, he is the best. Thank you.
You are why I do what I do, to
Thank
help
you.
people just like you, suffering, to try to give you some decency and quality back to your life.
Even all the complaining, I said, I don't want it, I don't want it, I don't want it. And you kept talking me into it. I'm glad you did.
You're
I'm
welcome,
glad
my
you
friend.
did.
You're welcome. Enjoy your life.
Oh, I will. And you too, huh?
Thank you.
You're a good guy.
Thank you. I appreciate it. All right, let's get you out of here.